Hello everyone, good evening. Welcome to another session where we are going to discuss few important image-based questions. These are more important for NEET PG aspirants for NEET PG entrance exam. So we are going to see one by one. This is part one where we are going to see basic images of general surgery. So the first one is identify the size of the Foley catheter. Again, it's a very important question where they can ask you question in different ways. They can give you the number and they can ask you the color, or they can give you the color and they can ask you the size, like that. So we have to remember what are the different colors of the Foley's catheter and their corresponding sizes. So as you can see here, this is your green color. So this is your something like usually 14 French catheter. This is, so you need to remember what are the different colors and sizes of the Foley's catheter. Among all these, at least try to remember black, white, dark green, orange, red. So these are the common things that we will be usually using in our daily practice. So as you can see, black is your 10 and white is your 12 French, green is your dark green is your 14 French, orange is your 16, and red is your 18. So you got to remember at least these things from this table. These are very important. And this is regarding Foley's catheter and the sizes. Coming to the next one. So again, it is another important topic where we have to see basic cannula sizes. So this is regarding IV cannulas. So the question can be tricky sometimes. Let's say, for example, they'll give you four options, and which of the following is the IV cannula of choice in a trauma scenario? Again, we need to choose. Let's say, for example, they are saying they have given gray, pink, blue, green. So out of these four options, we know that if gray is available, definitely we'll go for gray because that is the white bore when compared to all the other three things. So that is why we need to choose the options according to the question. According to the options available, we need to choose the correct answer. Okay, so again, this topic is very important. So these are the different sizes of the IV cannula, and there is a classical mnemonic by which you can remember this IV cannula. So this is OGBB. So O is your orange, which is 14 size. Next is your gray, then is your white that comes in between, actually as 17 size. Then is your green, which is 18 French or 18 gauge, sorry, 18 gauge. Then is your pink. Then is your blue, yellow, and this is latest one actually. This is the violet one. So as you can see, these two are usually used for pediatric patients, pediatric age group. Usually they use yellow and violet, and the rest of them we use commonly in our surgical patients. So this is regarding IV cannula and sizes. Now let's say, for example, just imagine a scenario we're going to operate a patient for some surgery. Let's take an abdominal operation, for example, or some other thing. So initially you will prepare the patient preoperatively, and you will take the patient to operation theater, and you will adjust the position of the patient according to our planned surgery. So based on that, we are going to see this subtopic, which is a very important one, nothing but your surgical position. So question is identify the surgical position. So what is this position where the leg end of the patient is elevated? So you know that this is classical Trendelenburg. So let's see what are the different surgical positions. So let's come from top to bottom or something like that. So you know that this is the patient. This is the position where the patient is moreover like sitting posture. This goes by the name Fowler's position. So you know that this is commonly used in neurosurgery operations usually. Now the next one is this is your jackknife position. This is your jackknife position. So usually for any bottom cases like any pilonidal sinus or something like hemorrhoids, fissure, fistula, only for certain procedures for fistula and fissure, usually we'll go for this jackknife position, and this is classical lithotomy position. Then we have seen this. This one is your Trendelenburg, and this is just ulta of this, so it is your reverse Trendelenburg. Yeah. So these are the common surgical positions we need to remember. If you want to remember something regarding Fowler's position, basically during neurosurgical operations, whenever we accidentally cut open any vein and suddenly you notice any decrease in BP, it means that patient has got air embolism. So usually the immediate step we need to do is we need to keep the patient in left lateral position and head low position. So this maneuver is called Durant maneuver. Durant maneuver. So this is one important point regarding forward's position. And you know that reverse Trendelenburg usually we use with the face turn to opposite, means we are when we do parotid surgery or something like when we do neck surgeries like thyroid, etc., where to facilitate venous drainage of head and neck, we usually keep the patient in this position. Trendelenburg can be used for either varicose veins or some pelvic surgeries, etc. Lithotomy is again classically used for bottom cases like your fissure, fistula, hemorrhoids. Then jackknife, as we have already discussed, it is for bottom surgeries again. So coming to the next one, let's imagine that the patient has been kept on position in required position. Now, let's imagine that there are two types of surgeries like open surgery and minimally invasive surgery. This is one of your minimally invasive surgery, that is nothing but your laparoscopy. So what is this instrument used for laparoscopic surgery? So you know that basically in laparoscopy we create something called pneumoperitoneum, where in the abdominal cavity we will inject or we will expand the abdominal cavity by using CO2. So to create this pneumoperitoneum, we have two types of methods. Like one is your open method of creating pneumoperitoneum, another one is closed method of creating pneumoperitoneum. So in closed method, this is the method shown in this picture. This instrument is called Veress needle. So this is your Veress needle. Now open again, it is something like there is a specialized instrument where we use a cannula. That instrument's name is Hassan's cannula. So your Hassan's method is usually open method, or you can directly go and open the abdomen cavity with the incision. So that is your direct incision technique. Then this instrument name is your Veress needle. This is your Veress needle. Now let's say for example it is an open surgery where initially obviously by painting the patient, by painting the surgical site where we need to do the surgery, now I'm going to make the incision. So what are all the different blades which are used for different procedures? So you need to remember the size of the blade and what is its common use. So let's look at the different sizes of the blades and their uses. So as you can see here, this is your 23 where the belly is something like a stout, and this is something like more or less the same with the pointed end. So this is your 23 and this is your 22, which are commonly used for abdominal operations. Now this is something like a smaller one where 15 is used for minor surgeries, and 11, the end is something like a very sharp here. So this is commonly used for your IND, like incision and drainage of the abscess, and also for anything like stab, to stab any abscess cavity. Usually we use this incision, and for incision and drainage you use this 11 size. Now what is not given here and that is commonly asked for MCQs is your 12 size blade. So this blade is used for usually commonly for suture removal. This is commonly used for suture removal. Now, I hope you know that where we insert this blade, that is nothing but this instrument is called BP handle, so Bard Parker handle. So based on different sizes, let's say for example you have 4 here and here you have 3. So usually 3 is used for your 11, 12 and 15 size blades, whereas 4 size is used for all the other big size blades. Okay, so based on the size of the BP handle, you can fit only specific sizes of the blades there. Right. Coming to the next one. So you have taken the scalpel into your hands. Now, what are all the different named incisions in the body? Let's remember this from top to bottom. And you can usually remember this is your classical incision of your cocker incision, which is also called cervical collar incision, commonly used for thyroidectomy. So this is your Cocker's incision. Now, if you come to chest, usually this is what we use for usually heart surgeries or something like that. So it is your midline sternotomy. Then this is something like where we are making midline sternotomy and bilateral chest area also. This goes by the name clamshell incision. Okay. Now this is something like your breast incisions where you are having infraareolar and this is your Gillard Thomas. This is your infraareolar. Now, coming to abdomen. So, this is something commonly used for your pancreatic surgeries or something like that. So, this goes by the name. Usually, it is something like a rooftop. So, it is rooftop incision, which is also called chevron incision. So, this goes by the name chevron incision. Now, this is usually used for open cholecystectomy, and this is your right subcostal incision. Then it is also called cockers actually. Then this is your midline abdominal incision. Then this is your, for example, if this is the midline, this is something like adjacent to your midline. That is why it is called paramedian incision. Then this is your transverse abdominal incision. This is your subumbilical incision. This is commonly used for open appendectomy, which is called McBurney's incision. Again, for open appendectomy, McBurney's is something like the classical skin incision. For example, if you give the same incision transversely here based on your McBurney's point, that is called your Lance incision. And this is your classical Fanon style. And this is nothing but your inguinal incision, commonly used for inguinal hernia surgery, open inguinal hernia surgery. So this is your inguinal incision. So these are the common named incision that we make, and of course here in this picture it is not given, but for usually we use for parotid incision. So commonly used incision is your something like a modified Blair incision, which is also called lazy incision, modified Blaze incision, or also called, sorry, not Blaze, it is Blair incision, sorry. So it is modified Blair incision, which is also called lazy S incision. Right? These are the common named incision that we need to remember. Now, coming to the next one. Let's say, for example, once you make the incision, obviously there will be little bit ooze and all. And we commonly use this instrument, which is called diathermy. And this is something like you are saying this probe with a single probe here. So this is your nothing but monopolar cautery. You have something called bipolar, where you will be having the tip of the instrument will be having two fangs. So here you don't need to keep any foot pad to the patient, whereas for usually for monopolar you need to keep a pad so that the circuit will be completed. So as you can see in the monopolar diathermy, you have two buttons here. One is your yellow, the other one is blue. So yellow is used for cut. So blue is used for coagulation. Okay. So as we press this button, different modes of diathermy will be uh, operating on the patient. So we need to remember what are the main differences between cut mode and coagulation mode. As you can see, this is your cut mode where the current is passed continuously, Whereas this is something like usually you have intermittent type of diathermy or the current passing. This is your coagulate mode. So please remember again, we need to understand that usually cut is something like a low voltage current, whereas your coagulation is something like a very high voltage current. And also usually when you operate with cut mode, this is something like the energy is concentrating on a smaller area, whereas in coagulation mode usually there will be dissipation of the current in a large area again. So there is minimal lateral spread and collateral damage in case of cutting, whereas there will be excessive lateral spread in case of coagulation mode. Okay, so again here something like the main principle of your coagulation is this dehydration effect, where there will be loss of cellular fluid and protein denaturation, and which results in your coagulation of tissue. Okay, whereas here you are having something called vaporization of tissue. This is because the tissue is very heated rapidly to a very high temperature. Okay, so here it is your vaporization of tissue, right? So moving to the next one, these are all other energy devices we have, where this classical instrument is called harmonic scalpel. As you can see from the instrument here, this is from Ethicon brand. So this is your harmonic scalpel. It is nothing, it is based on ultrasonic energy actually, and the energy range will be usually 20K to 50K. So this is used this is a very nice instrument we use both in open surgery as well as in laparoscopic surgery. So moving to the next one, Ligashore, where this is from the team of Covidion actually. So it is a vessel sealing system which is used both in lap and open surgeries again. And again, we need to remember here you are using the combination of both pressure and energy to create the vessel fusion. And usually this is used to seal the blood vessels which are up to 7 mm. So we need to remember this number. So up to 7 mm diameter vessels can be easily and effectively sealed with this instrument which is called ligature. Now coming to the next one. So let's say for example you have opened the anterior abdominal layers. Now you want to uh, retract the abdominal cavity using some instruments. So they are called retractors. Okay, so you have two types of retractors actually. So one is self-retaining self-retaining retractors. The other one is non-self-retaining. Okay, so what is this instrument shown here in the picture is your Balfour self-retaining abdominal retractor. So this is something like once you fix the retractor, you don't need to hold it again. So there are screws where with the help of which you can adjust your retraction, and this is something like a self-retaining retractor. Okay, this is your self-retaining retractor, right? Coming to the next one, these are your non-self-retaining retractors. So this is your Devers retractor. So this is your Devers retractor, commonly used for anterior abdominal wall retraction or during open cholecystectomy or some other surgeries for your liver. So commonly for liver retraction, etc. So we use this Devers abdominal retractor or Devers retractor. Okay. Now these two are little bit confusing. So first one is your Doyen's retractor. This is your Doyen's retractor. Whereas this is your Morris retractor. Okay, Morris retractor. You can simply remember from the one end of the instrument where Doyen's is something like a curved, whereas Morris is something like a little bit more or less, and this is something like a more of a folded one. This is more or less like a flat and only little bit curved. Okay, this is your Morris retractor. This is your Doyen's retractor. Again, these are commonly used for abdomen retraction. Let's say, for example, you are doing some simple surgery like open appendectomy or open inguinal hernia surgery, where we use this instrument commonly. So this is your Langenbeck. So as you can see, it is L shape. So this is your Langenbeck retractor. Now, this is a modified version of that, and this is your Zerni's retractor. Zerney's retractor. Okay. Now, let's say for example, during the operation, we hold certain tissues and all. So to hold usually any tough structures, we use this instrument. So this is your Alice forceps. Alice tissue forceps. Okay, so this is usually commonly used for tough structures, like for example, rectus sheath or any fascia like that. Whereas you can see this is your Babcock's forceps. Again, this is Babcock's tissue forceps. So this is commonly used to hold any tubular structures usually. Let's say for example, you have appendectomy. So when we do appendectomy, we hold appendix. So this is your first one. Second one, we can hold bowel, small bowel or large bowel. So during usually resection and anastomosis, etc. Let's say, for example, if you go a little bit up during gastrojejunostomy or for any pancreatic surgeries, you can hold those structures gently. So stomach, pancreas, you can hold these structures also using Babcock's forceps. Okay, this is regarding tissue forceps. Coming to the next one. So let's say, for example, you have finished the surgery, and to monitor what is happening inside the cavity, you keep something called drains. Again, when you come to classification of drains, you have two types. One is you have open drains, and the other one is closed drains. Again, in closed drains, you have something called non-suction drains and suction drains, where the drain will be acting on the principle of suction, negative pressure. Okay, so now as we can see from these pictures, this is your ADK drain. ADK nothing is nothing but your abdominal draining kit. So usually for any abdominal, major abdominal operation like perforation, closure, or something like usually for any major surgery, we usually use this abdominal draining kit drain. So ADK drain. This is again, as you can see, one end of the suction, or sorry, one end of the drain is kept within the abdominal cavity. So let's say for example, you have abdominal cavity here. So usually you will keep one drain, I mean one end of the drain inside the abdominal cavity, whereas the other end will be like into the bag. So this is something like a closed drain. So, but now let's say for example, you are having another drain here, which we usually commonly use for, let's say for example, you have done any hydrocele operation or something like a orchidectomy, where one end of the drain will be usually within inside the body and the other end of the drain will be outside. So this is something like a open drain. Okay. Again, the third one is something like again one of the type of your non-suction drains. This is called pigtail catheter, commonly used for liver abscess drainage, etc. So this is your pigtail catheter drain. As you can see, this is something like a pigtail. Okay, one end of the catheter drain is like a pigtail that is usually commonly used for liver abscess drainage. Okay, again. So these are all something like a non-suction drains. Now coming to the next one. Again, this is something like one of your closed drains. This is called intercostal drainage tube. Okay, this is your intercostal drainage tube, which is also called chest tube. So usually we go for chest tube, whatever the abnormal accumulation of something in your pleural cavity, we usually go for this ICD tube. Let's say, for example, pyothorax, pneumothorax. So, any massive pleural effusion or something like a massive pleural effusion, etc. So, whatever the abnormal accumulation present within the pleural cavity, to drain that, we usually go for chest tube or IC drainage tube. This procedure is usually called tube thoracostomy. Tube thoracostomy. Okay. Yes. Now you know that this drain is usually specifically inserted through a site called triangle of safety. Okay. Now what are the boundaries of triangle of safety? As you can see, usually this triangle is formed by anteriorly it is formed by your lateral border of pectoralis muscle, whereas posteriorly it is formed by latissimus dorsi. And this base of the triangle is commonly placed is usually by a horizontal line drawn at the level of nipple. So a horizontal line drawn from nipple, or otherwise you can take fourth intercostal space as the base of the triangle of safety. So this in between these three lines, this is called your triangle of safety. You can safely insert the ICD tube in this triangle, and you know that where exactly with respect to ribs means you know that the lower end of the ribs is having neurovascular structures. That is why we usually keep the drain through something like at the upper end of the lower rib. So this is where we keep the drain. Now, again, this is something like a suction drain. So, this is another example for your closed drain. So, one end is inside, the other one is into the chamber. So, this is your suction drain. So, the trade name is your Romovac suction drain. So, this is commonly used for in case of any breast surgery, thyroid, and also few, let's say for example, venting psoas abscess, drainage, etc. Okay, so this is your suction drain. Now, let's say for example, you finished everything. Now you want to close the wound. So you know that basically you will use an instrument called needle holder. And how will you differentiate between your needle holder and this is something like your straight hemostat, or which is also called straight artery forceps. So how will you differentiate between both of these means this is something like you are having transverse serrations, whereas here you are having crisscrossed serration, and also you have something called groove. So you have a groove here. This is to hold the needle. Okay. Now, obviously, what will you hold in the with the needle holder? Needle. So again, needles is very important topic. You need to remember few basic things. So you know that these are all the different configurations of the needle, and we need to remember specific needle shapes. So half circle needles are usually used in GIT, and J shape is something very convenient and very useful to close the port site in lap surgery. So this is for laparoscopic port site closure. And a quarter circle eye. So this is commonly used for your eye. Now, where compound curvature needles are usually used for oral cavity. Okay, so these are all the different shapes of the needles. Now, coming to the what are the different suture materials we have. So we need to remember this classification, and this is a very important topic again. So coming to the, you know that they are based on the composition and whether they are absorbed or not. There is a classification of suture materials. So what are the different natural absorbable suture material is your catgut. Again, it's a misnomer. It is basically made from your submucosa of the sheep actually. Okay. Now coming to synthetic and absorbable, what are the common examples? Again, we better remember the actual composition rather than the trade names. So please remember, one is polyglactin. Now polydioxone. Next is your, sorry, polyglacaprone. The last is your polyglycolic acid. Okay. Yes. This polyglactin is nothing but your glycol, and this polydioxone is commonly called PDS. This is your monocryl polyglycaprone. I'll show you the pictures. So this is your monocryl, and polyglycoside is nothing but your dexone. Okay. Now coming to natural non-absorbable suture materials are, one is your silk, the other one is linen thread. Okay. Now, coming to synthetic non-absorbable is something we need to remember. What we use commonly in inguinal hernia surgery, or for that matter, any hernia surgery, where we can use the suture material both for posterior wall reconstruction and also for fixing the mesh, is your polypropylene, which is commonly called Prolene, blue color suture material. Now, the next one is your polyamide, which is also called nylon. This goes actually, the trade name will be ethylene. Okay, so this is also called nylon. Now, last one is your polyester. This is your ethibond. And surgical steel is also something like your non-absorbable synthetic suture material. Now, coming to the next part, these are all the common pictures of different suture materials. So, as you can see, this is your polyamide. So, monofilament polyamide. Again, you know that based on how many filaments are there within the suture material. So, based on that, you have got two types. One is monofilament, the other one is polyfilament. The disadvantage of polyfilament suture material is that they have got crevices. So they have got crevices where the bacteria can go there and accumulate. So there is more chance of infection with your increased risk of infection is present with your polyfilament suture material. Now coming to this one, which we use commonly in hernia surgery, this is your monofilament polypropylene blue color suture material, and it has got a characteristic property where once you remove the suture material from the back, it has got a tendency to coil upon its own. That is called memory. Okay, so this is the characteristic feature of one of your proline. Now, this one, the trade name is Vicryl, but you can see here the actual composition is your polyglactin. This is commonly used for bowel anastomosis or something like subcuticular suture, where we use, or for muscle suturing, like that we use commonly for this polyglactin suture material. Now, this is your chromic catgut, where again it is something like a monofilament absorbable suture material. Now, this monofilament polyglycopran is nothing but your monocryl. So, you know that monocryl 30, so especially this 30 is used commonly for subcuticular sutures. Subcuticular sutures, the suture material of choice is monocryl. Next. So these are the different suturing techniques what we have here in the picture. So these are all suturing techniques. So this one is your interrupted. So this is your interrupted suture. You know the principle basically. Let's say for example you are having X depth of wound. You need to take the bite X centimeters from the edge of the wound, and in between one suture and the another suture you should have 2x distance. This is for your interrupted suture. Now as you can see from this one, this is your continuous suture technique, where we start from one end and we finish at the opposite end continuously by suturing the suture material. Now this is your mattress suture technique, where again this is your horizontal mattress, this is your vertical mattress. Where in vertical mattress, if you observe carefully, initially we are going from one end and coming from opposite side, and again coming to the same side where we have started. So this is your vertical mattress. Whereas here also more or less the same thing, but the second bite is same, is something like at the same level you are taking the suture material. So this is something like, let's say for example you have gone from one side to another, you are taking bite on the same side at the same level, and coming to opposite side on the same level where you have taken the first bite. Now you will be here, you will be tying the knot. So this is your horizontal mattress, and this one is something like more of a something like cosmetic. This is your subcuticular suture material, where the suture material of choice is monocryl 30. Usually we go for monocryl 30. What is the trade name? I mean, what is the composition of monocryl? Polyglycopran. Right? Now, is there any alternative to skin suturing? Instead of suturing the skin wound, what are the alternatives we usually have? Let's say, for example, if it is something like a very superficial laceration, and you have something called cyanoacrylate. It is called cyanoacrylate glue. So the composition is N-cyanoacrylate glue. It is called surgical glue. Then this is one option. The other option you can go is for staples. So you know that there is something called skin stapler, just like your bowel staplers. So this is another method. The third one is something like where you have something like a adhesive strip, where you can simply close the wound by applying that strip over the wound. This is called your adhesive strip. So this is part one of our image based session. We will meet in the next session with the other topics. Thank you.